As far as skin issues go, I would argue that getting blackheads has got to be one of the most annoying problems people can deal with, but today I'm going to show you how you can get rid of them. Welcome back to a crash course in acne where I go over all the different types of acne and how you can treat them. Yesterday was whiteheads. Don't forget to go check out that video if you haven't yet, but today we're talking about blackheads. So to get us started right away, we're just going to go over what blackheads are and why they happen. Right here is a healthy pore. This is a blackhead. It's essentially kind of similar to a blackhead, except the dead skin and bacteria that clogs the pore kind of hardens when it oxidizes, and then it creates this kind of darker, clogged pore. I would say that blackheads most typically appear around people's nose and cheek area, but you can also get them on your chin, on your forehead. Typically, the T-zone and cheeks is the most common place to get them, but the treatment for them is actually super simple. But before I go any further, pore strips do not work. Please stop wasting your money on them. The only thing they do is rip off a layer of your skin. I know you think you're seeing results, but at the end of the day, those pores are just going to fill back up with oil, dead skin, bacteria. The pore strips are not an effective long-term treatment, no matter how satisfying you think they are. So one thing I came across that I think would actually be super helpful for everybody is The Ordinary actually made a guide of their products that help treat blackheads. I don't know if you can see in the corner there is salicylic acid, the AHA/BHA solution, glycolic toner, the niacinamide, and the retinoid treatment. All of these are really great. Salicylic acid has been one of my favorite ingredients of all times. Theirs comes in a serum. I use a face wash. Either one works, but this really helps penetrate your pores and clean out some of that grime. The AHA/BHA solution is another really great option for clearing blackheads, whiteheads. I just want to warn everybody, for people with sensitive skin, I would not use this treatment more than maybe once or twice a week just because it is very harsh. Glycolic acid, same thing. I would only use it every other day if you have sensitive skin, but it is a very effective treatment. Niacinamide helps reduce the amount of oil that gets into your pores, which can help a lot. And then retinoid, a lot of people go with a prescription, but the over-the-counter ones also work. Another super helpful ingredient is benzoyl peroxide. This panoxyl wash is one that I've found to be very popular. I have not personally used it, but I've heard a lot of really great results from people who have severe acne. As you can see, the benzoyl peroxide concentration is a 10% concentration. So again, my sensitive skin people, just hang on. I'm going to show you some stuff you can use instead. This is for people with more resistant skin who are really looking for a more hands-on treatment. The CeraVe benzoyl peroxide wash only has 4% benzoyl peroxide, so this would maybe be a better one for someone with slightly more sensitive skin who is really struggling with, blackheads that are super noticeable. And then for anyone who is totally content with their face wash who's dealing with blackheads, a benzoyl peroxide spot treatment can also work great. The one by La Roche-Posay, probably one of the best ones. And as always, thank you so much for watching. I hope this was helpful. Don't forget to follow me to stay updated with Crash Course in Acne and more skincare related content.